Welcome to Cosmo for Treatment Centers, a platform designed to revolutionize how residential care teams understand and support their patients. Whether working with adolescents or adults, treatment centers often face complex challenges. Many patients arrive with histories of trauma, emotional dysregulation, and difficulties in trust, which can strain the relationship between patients and staff. This often leads to frustrations, misunderstandings, and even explosive reactions. Cosmo is here to provide the tools and framework to address these challenges effectively. At the heart of Cosmo is the Collaborative Assessment Framework, a methodology that enhances therapeutic outcomes while improving relational dynamics within care teams. By using tools like the Rorschach, the Picture Frustration Study, and the Thurston-Craddock Test of Shame, Cosmo provides care teams with deep insights into patients' emotional worlds, interpersonal patterns, and coping mechanisms. The Thurston-Craddock Test of Shame is particularly valuable in treatment settings. It explores the complex and often hidden dynamics of shame, a critical factor that can influence behavior and therapeutic engagement. By analyzing patients' narratives in response to carefully designed prompts, the TCTS uncovers patterns of emotional vulnerability and defenses against shame, such as withdrawal, aggression, or contempt. These insights allow staff to understand the deeper motivations behind a patient's actions and develop strategies that build trust, resilience, and self-esteem. These tools act as a kind of user manual, equipping staff with the understanding needed to build empathy and tailor interventions to individual needs. One of the key benefits of Cosmo's approach is its ability to amplify empathy within care teams. By uncovering the underlying reasons behind a patient's behaviors, whether an adolescent struggling with peer interactions or an adult coping with unresolved trauma, our tools enable staff to move beyond reactive responses. This fosters a more compassionate and informed perspective, reducing the risk of negative countertransference and minimizing explosive actions. As a result, patients are more likely to feel understood, supported, and engaged in their treatment. Cosmo doesn't just focus on assessment, it actively involves both patients and staff in the therapeutic process. Structured feedback sessions and reflective activities help patients gain a greater understanding of their own emotions and behaviors, empowering them to take ownership of their growth. At the same time, staff develop a shared vision of the patient's needs and potential, creating a cohesive and goal-oriented care strategy. In addition to transforming individual patient care, Cosmo also supports team development. By providing training and a framework for integrating diverse data sources, such as performance-based assessments, self-reports, and clinical observations, Cosmo ensures that all team members are aligned in their understanding and approach. This alignment fosters trust, cohesion, and a sense of purpose within the team, creating a more effective and therapeutic environment for all. Cosmo is more than just a tool, it's a comprehensive system that shifts the focus from managing behaviors to building environments that support growth and healing. By combining precise assessments, enhanced empathy, and collaborative teamwork, Cosmo helps treatment centers deliver care that is not only effective, but truly transformative. Discover how Cosmo, with tools like the Thurston-Craddock Test of Shame, the Rorschach, and the Picture Frustration Study, can empower your treatment center to create deeper connections and achieve better outcomes. Together, we can make a lasting difference.